Hi, and welcome to East Meets West, an integrative approach to men's health. I'm Dr. May. I'm a naturopathic physician, board certified in endocrinology, and we're here to talk about all things men's health. Mike, introduce yourself, buddy.
I am Michael Johnson. I've been practicing acupuncture for 15 years now, and I treat a lot of men's health stuff too. So I'm really excited. Dr. May and I worked together for years, and we have some really awesome and unique approaches to integrative health where we both work from our perspectives to help men who are going through a lot of different issues. So I'm excited about today.
Another one is excessive alcohol use. This one I find is a huge one as well. So guys, especially when we're talking about beer, but any alcohol really, will upregulate an enzyme that's produced by your fat cells. It's called aromatase. Now, what aromatase does is it converts testosterone into estrogen. So the more alcohol you drink, especially beer, then the more of this enzyme you're producing and the more of your testosterone you're going to convert into estrogen. So literally, the more alcohol you drink, the less of a man you become. Literally. So really watch the alcohol intake, and just know there's no safe level of alcohol use. Alcohol you have to think of as like a stress on your system. Now, if you're vital, remember we talked about vitality there in the chi. If you have a lot of vitality and chi, you can take on some stress and still function normally. The problem is if you've got a bunch of other stuff going on, maybe you're pre-diabetic, maybe you have some high blood pressure, maybe you're super stressed, maybe you have some sleep apnea, you're not sleeping well. You've got all these other things that are going on as well. You realize your vitality is not that good. Then alcohol is going to be an even more robust stress on your system, which is just going to knock you down even more and affect you in a greater way. So think about that next time, because we often use alcohol as a coping mechanism for stress, right? So we feel stressed. We're like, man, I'll just have a little alcohol, a couple of beers or something. And that just kind of relaxes me and helps, mitigate some of the effects of that stress. And, occasionally that may be okay, but not a great long-term solution. It's going to have, the opposite effect than what you're looking for.
I agree, and everybody also has a different idea of what high alcohol use is. So I've talked to
Mhm.
some people who thought like, oh yeah, I just have 4 shots at bed or something, and that's normal, because to them that is normal. But it's like, well, but when we're talking about what we're talking about right now, health wise, it's like it's
Mhm.
going to have serious effects. Or I'll just have a 6 pack of beer a night, and then
Yeah.
I'm fine.
Yeah. Yeah. I'm amazed at what some guys think is normal, like not excessive alcohol use. Like for me, I would even say like, and I've been guilty of this, having 1 to 2 like beers or a cocktail or something a night, but having it consistently like most nights of the week. Man, over after a while, you just don't feel good. You can definitely feel the effects even at that level. But I'll have some guys come in and they're drinking 3 or 4 drinks a night, and they think that that's not excessive because it's not a full 6 pack, or not drinking during the week and then having like 2 6 packs or half a dozen cocktails or something on the weekend is sufficient. So it's kind of more of the binge drinking on the weekends, and that's not a problem because it's not every night. So again, I think most of us have a pretty decent intuition about what's really too much. I just had this conversation with a guy this week and asking him about his alcohol intake. He's like, yeah, a few drinks here and there. And I was like, well, how do you feel about that? He's like, I feel like it's probably too much. And I was like, well, if you think it's probably too much, it's definitely too much.
Yeah.
You've already figured that out. You just have to accept that, right? And then do something about it.
Yeah, and you're right. It's a terrible self medication. It's like, I mean, I love whiskey. I love a good
Yeah,
whiskey, but
absolutely.
you have to realize like it's all about balance, because you're technically poisoning your body on a micro level every single
Mhm.
time you drink it, and then your liver is having to work to get it out of your system. So
Yep.
you have to realize like, well, if you have poor health, poor vitality, you have liver issues, whatever, kidney issues, then it's going to affect you even more because you're already having these issues and now you're putting even more stress on those systems.
Yeah. Well put, man. That's good. Some other lifestyle factors, being overweight. So again, kind of going back to that aromatase enzyme that's in the fat cells. This is a scenario where kind of the fatter you are, the fatter you get. So having some fat mass, produces more of that aromatase, which converts more of testosterone into estrogen. Estrogen is going to make you want to gain fat mass. And so this is kind of one of those kind of perpetuating things that just, gets tough over time. And so this is one of the strategies that we can use, is trying to reduce that aromatase enzyme by using various different things we'll get into here in just a little bit. Some not so common things, some chronic health conditions like kidney disease or liver disease, prostate issues, especially if you're taking medication for prostate cancer or other prostate issues. Prolonged bicycling. So I
Oh, that's wild.
see, yeah, I know. I see a decent amount of athletes, and especially guys who are doing this for years and years. We can definitely start to see some issues there where they're starting to damage some of the nerves in the genital area, and it can eventually start to affect blood flow there. And then let's see. Oh, the last one that I kind of wanted to leave for last, because I think it's a profound one too, is low testosterone. So low testosterone can actually directly affect your ability to have an erection, just because of how the testosterone interacts with nitric oxide and all that inside your testicles, and the penis as well. And so, if you do have ED and you've never had your testosterone checked, definitely get a check. That's a really great place to start. All right. So as far as
Nice.
causes, Mike, those are kind of the big kind of Western side, things that I always kind of go through. Anything else on your side that you think may
Yeah,
be good?
you mentioned most of it, but we focus a lot on the stress component, and not just like, oh yeah, I feel stressed, but all the physiological stresses you have in your system, the psychological stresses, anxiety, depression, that sort of thing. It's just that people just don't think about them because, like, well, everybody's going through this. Oh,
Yeah.
everybody, has a hard time in life sometimes. And especially guys, especially a lot of the old school guys I'll meet,
Hmm.
or blue collar guys, this is just like, well, it's just part of my life. Like they don't really talk about it because it's just part of their life. So I really try to get to the bottom of that with people of like, well, you're still putting your body's still getting put in this fight or flight. And it doesn't matter, and what's stress to one person may not be to another. I think that's
Yeah.
another big one, is that some people can, like I'm in North Carolina. There's been a massive amount of stress around
Yeah.
huge flooding in Western North Carolina. I didn't have power for 10 days and,
Mm-hmm.
couldn't find water, all this stuff. And for some people, it's like they're going to have a different reaction than other people. So realizing a lot of it also depends on you and your reaction, and really digging into how your body, how your mind reacts to these things, and then how
Hmm.
it affects your health,
Yeah.
is a huge, huge thing because everybody's different. And what's stressful to you might not be to somebody else.
Yeah. Great point, man. And what's stressful to you now may be different than what you could take on 5 years ago or 10 years ago.
Oh,
So
yeah.
sometimes that's hard to accept. Like, oh, well, I did this, 5 years ago and was able to, like, be fine and stay healthy. Well, things are different now. You're a little older. Your resiliency's down for other reasons. Like, you may just not be able to take on, the kind of level of stress now that you could 5 years ago. Doesn't mean you can't at some point in the future be able to do that. But at this point, sometimes you just have to accept that and then figure out how to kind of dig yourself out of that hole.
Yeah, and also the fact that everybody has a different breaking point for stress. It's like you get accumulated stress, you'll be fine. I think I'm fine. I think I'm fine. And at some point, it pushes you over the edge. And everybody has that point. It's different for everyone, but everybody has that point.
Yeah, and I'd say guys, we're more likely to push it until we hit that breaking point, and
Yeah.
then once you hit the breaking point, we need some higher interventional things to try to get you back to normal. Or you may have a heart attack or something. Like, it's something like, I want to say I'm going to mess up on the percentage here, but it's somewhere around 25 to 50% of first heart attacks in men are fatal. So
Ugh.
it's a pretty significant percentage there. And like, oftentimes that's, to these men, this is the first sign that they realize like there's something wrong. And it's too late for some guys at that point to do anything about it.
Yep. And again, this goes back to like paying attention. If you're having erection issues, paying attention to it, because it could be partially psychological. There could also be something physiological, and you need to figure out exactly what's going on before it gets to the point that you have the widowmaker or something, and you're like, oh,
Yep.
oops.
Yep. Absolutely. All right, let's get into some testing for erectile dysfunction. Like, how do we figure out if a guy has this or not? Okay, so one of the ways, and this is what you're mostly going to do with your primary care, is like looking for underlying causes. So this is where some blood tests come in, urine analysis, hormone testing, all those kind of things, and to try to figure out, what is kind of the root cause here. So looking at your T levels, checking your blood pressure, all that kind of good stuff. Now, once you've kind of gone through that and you're not really seeing any obvious answers, this may be where a referral to a urologist may come in handy. This is where these guys can do ultrasound to actually look at blood flow to the penis to make sure the vascular issues are okay. There's also another test called the nocturnal penile tumescence test. Now, this just looks at like nighttime erections and if you're able to actually have them. This is a really great indicator of erectile function. And this is kind of throw this out there too, guys. Like you should be having somewhere around 3 to 5 nocturnal erections a night. So you're not going to be able to notice that because you're asleep. But when you first wake up, most days out of the week, you should be waking up with an erection, because an erection is what we call a parasympathetic response, which means it's going to happen when your body is relaxed in that sort of rest and digest kind of part of the nervous system, right? So you should wake up if your vascular system is healthy and you're able to have an erection. You should wake up most days with an erection. If you're not, then that's you need to dig into maybe why that is, whether it's you're not sleeping well or you may have a little bit of apnea going on or whatever. Okay.
It's really
Well,
cool.
this test also at the urology, this used to be called the stamp test, because what they used to do is they'd put a roll of stamps around the penis depending on your girth and how many stamps you needed. They would put that on there, and then if you broke that throughout the night, we knew that you were having an erection at nighttime. Now they have better testing, things to use now, so the stamps aren't used anymore. But it's funny to kind of know the history of it.
I didn't actually know that. That's interesting.
Yeah, yeah,
So now a bunch of guys are going to be using stamps, after this
right.
podcast.
Yeah, that's right. And then there is an injection that you can give just to kind of stimulate an erection. We sometimes use this when we're doing PRP, which I'm going to talk about here in just a little bit as well. So that's kind of, for the most part, that kind of covers most of the tests that we would do for ED. Any comment, Mike, before we jump into
No,
treatment?
and we're going to rely with Chinese medicine. Actually, I work a lot with doctors, so relying on those tests are good. I'll check the pulse, I'll look at the tongue, but I really like to see when doctors are doing these kind of tests, and find a doctor who's willing to. I think that's one of the big things, is that some doctors are overworked and spend 5 minutes with you and they're not going to run these tests. And so making sure you go to somebody like Dr.May who's actually going to take the time to really get to the bottom of what's going on, instead of just throwing some medications at you and hoping for the best.
Yeah, great point, man. Like, guys, be your own advocate. Like, force your doctor to be a good doctor. Like, oftentimes it's not their fault necessarily if they're, if they're in a system and they have to see like X amount of patients per day and they just only have so limited time with you. Okay, I get that. That's a failure of our systems, right? But that doesn't mean that you have to accept that. You can kind of hold their feet to the fire and say, I don't want to take this medication until I understand better why this is happening. Let's investigate that more. What does that look like? Okay. And be your best advocate. We're not, in general, guys, we're just not really good at doing this. Women are much better at it. Guys, we're not so much. But you're not going to really find any answers unless you do that. So be your best advocate.
Yep. I mean, some of my best patients that for ED were patients who came in with their wives, and their wives are the ones that
Hmm.
brought up, like,
Yeah.
this is an issue. Like, let's talk about it, because
Yeah.
he would have never brought it up in the first place.
Absolutely. 100%. Yeah. All right, let's dive into some treatment. So I'll just kind of give you my overview. Obviously, number one is correcting the underlying cause. So I'm not going to throw testosterone or Viagra and all that kind of stuff, at you until we have a better understanding of what the cause is. And that's stress, what your vascular health is, your testosterone levels, all the stuff that we've been talking about so far. Now, if we have a better sense of, let's say, like, all right, yeah, you do have some vascular health issues, maybe a referral to a cardiologist is warranted to get a better understanding of what that vascular health looks like. We may start with some medications that most of you, I'm sure, are probably familiar with: sildenafil, which is Viagra, or tadalafil, which is Cialis. Now, these inhibit an enzyme called the 5 or phosphodiesterase 5, which allows small blood vessels to dilate. So this will help with an erection if you don't have your arteries aren't too stiff or clogged down there. So sometimes that's a really good sort of test, is to see, are you actually responding to these medications? If you're not, your cardiovascular disease may be more extensive, or your ED may be caused by some other issue, whether it's neurogenic or psychogenic or whatever. And so sometimes, and this is part of medicine, sometimes there's just some trial and error involved. And sometimes we try supplements or medications just to see how you respond to them. And that gives us information that's really valuable as well. On the extreme end, and this is mostly for guys who are, up there in age, more in the 70s and 80s plus, we may have to do some penile injections. Definitely not something that most guys want to do, but if you're dedicated enough and you're really adamant about having good erections, then you can do injections like Trimix, which again is just going to relax the smooth muscle, dilate those arteries in the penis, and get better blood flow. And then P shot. Now, P shot is one that I actually do like doing in younger guys, like when you first start to kind of feel some changes and we understand like what the cause is. Then doing a little bit of PRP into the penis works really well. This is pretty safe and very effective, in my experience. This is basically, if you don't know much about PRP, it's platelet rich plasma. Basically, what we do is we draw your blood and we spin it down a couple of times in this special centrifuge to compact a lot of the growth factors from your platelets. So we get this smaller amount of volume that we then inject into the penis. And it's just the top part into the actual like cavernosum tissue. And it helps to regenerate like tissue there. And that can include some vascular health as well as the tissue space itself. And so we do tend to see sometimes an increase in length. More so, we see an increase in girth and better sensitivity. And so it definitely is a great augmented sort of uh, another treatment, sort if you will, for ED.
Is it as unpleasant as it sounds, or no?
No, it's not actually bad at all. No, it's I either do a nerve block, so you don't really feel anything, or at least a topical, anesthetic. So it's really not bad at all. I've done it on myself, and it wasn't bad. I did it on myself without any anesthetic or nerve block, just to see what it would be like, and it wasn't bad at all.
Oh, wow.
Yeah.
It's good to hear. Yeah, and people always think it's funny because acupuncture, you aren't actually needling into the penis for this, but people always think it's going to be this terribly painful experience, and it rarely is.
Yeah. 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 It sounds a lot worse than it really is. It's really not that bad.
Hmm.
Um, some other things too, vacuum devices and then penile implants. Obviously, those are kind of very end stage kind of things that you want to consider, but those are some tools that you have. Obviously, like the first one, correcting the underlying cause is where I spend the majority of my time like focusing.
That's smart. I mean, it's kind of the same thing I do. Is like there's points I can do if it's there's some primary issue. Like I'll have people come in with nerve damage in their low back, or some kind of primary issue that's causing the erectile dysfunction. And there's points I'll do around the sacrum where the nerves come out in your low back there that can be really beneficial. there's
Hmm.
there's a point under the tailbone that's called long and strong, the English name, and it works. I mean, it's insane that how much
Yeah.
it works. So sorry, helicopter. But yeah, so
Wow.
but yeah,
That's
so that point is amazing. But then a lot of times there's also the component what you talked about, where your sympathetic nervous system, you're under a lot of stress. There's a lot of fight or flight, and there's points I can do. They're going to help the parasympathetic, and so people will notice, like, hey, like
mhm.
this combination worked amazingly because, sometimes there's both. It's not just either or. Sometimes you have both things going on. So
Yeah. Yeah, I absolutely love acupuncture for this kind of scenario, especially guys who come in and they're like, you can tell they're obviously stressed, but they won't admit it, or they haven't been able to really accept it, or even like sense it. Maybe they're just not in tune or connected to their body. You can tell it's obvious, but they're like, no, I'm not stressed. Like acupuncture seems to be like magical for these guys just because it does kind of calm that nervous system down. And then when that happens, all these other things start working better, you know?
yeah, exactly. And a lot of times people won't even realize it. And I'll warn people when I do certain points, like if you get an erection on the table, that can happen. This isn't like,
Mhm.
oh, something went wrong, or oh, you need to be embarrassed. Like, no,
Yeah.
we're deliberately working on these things. We're deliberately activating these pathways. So if you
Mhm.
do, you know what? It's normal. It happens. And just not to make a big deal of it, because it's not a big deal. It's like I've seen all this before, and it's just part of the treatment. And just letting people know that up front is really important, because every time you go into a treatment, everybody's like, is this normal? Is that normal? It's like, well, for one thing, there is no normal. It's like some people respond in different ways. But
Mhm.
yes, I've seen this many times before. It's not unusual, and it's nothing to worry about.
Yeah. Yeah. Completely agree. Awesome. Well, man, that's about all I have right now. Any other thoughts?
Yeah, so I focus a lot on the acupuncture. There's also some Chinese herbs that can be good. And again, this depends on underlying diagnoses. So, if it's a stress component, if there's like some secondary
Mhm.
stress, anxiety, then there's Chinese herbal formulas like the Free and Easy Wanderer, Xiaoyan, that's great for the stress component. And it's
Mhm.
not something I'm going to prescribe to somebody if that's not what's causing it. If it's more of a nitric oxide issue, which we could talk about in another episode because we don't really have time here,
Mhm.
then Yo Gui and some other herbs there can really be beneficial. But it's all about what is going on underlying. I'm glad you spent a lot of time on that, because it's absolutely true. It's like you don't just want to throw stuff at it and see what sticks. It's like you want to see, okay, we have a fairly good idea of what is causing it, and then
Mhm.
honing in the herbs based on that, honing in the acupuncture based on that is going to be essential. And just a success
Yeah.
story, I had somebody come in when I was in Oregon, and they didn't want to talk about ED. And finally, they brought it up. They had nerve damage in their low back, and then they also had anxiety around not being able to be with their wife. And
Mhm.
both components played. So I did the points in the low back and under the tailbone. I did some stress points in the ears. And the next visit, his wife brought me chocolates and like coffee, and just said, whatever you did is a miracle. Like, this is the best anything's been in years. And I don't understand why it works, but it
Yeah.
did. Please keep
Mhm.
doing it. But it's like one of those moments where it's like, you figure out what's going on underlying, and then you treat it appropriately. And
Mhm.
look, it works. And when somebody's finally comfortable enough to talk about it. So I think
Yeah.
my final thought would be, have a doctor you trust. And if you don't have a doctor you trust, then find one you trust. Like, talk to Dr. May, do a Zoom with him, do a Zoom with me, something, anything to where you need to feel comfortable. And if you're not comfortable talking about these things with your doctor, then whoever it is, find a different doctor. Find a doctor
Yeah.
you're comfortable talking about these things with. And man, don't live with this. Don't just hide it. Don't live with this, but do something about it. And you're going to feel better. Your loved ones are going to feel better, and your life is just going to be better. So,
Yeah. Yeah. Great point, man. Yeah. I totally blanked on the nitric oxide part. Like, gosh, we could have spent another 15 minutes just talking about that. So I'll
well,
just
we're
kind
going
of
to be
throw
doing
that
a
out.
second episode on this too. So,
Yeah. Yeah. Definitely. We'll dive in more to nitric oxide too, and like citrulline and L-arginine and all those kind of things that you can use for treatment strategies there. But we're kind of running out of time today. So I think we're gonna end it here, and yeah, just kind of signing off here until next time, guys. Again, be your best advocate. That's kind of the best thing I can pull from this episode. Is this is an uncomfortable subject? Don't worry about it. Like, just you just gotta attack it, man, and go after it and be your best advocate. And if you can't
yep.
find a doctor that you feel good, working with, and just keep looking and keep looking for one that will work with you and look for those causes.
Exactly. And email us if you have any questions or concerns or thoughts, or feel free to comment on the podcast, and we'll get to everything we can because we love just helping people. So get help.
Absolutely.
Don't ignore it.
Absolutely. Great point. All right, Mike, great talking with you, buddy. Guys out there, thanks for tuning in. And until next time, stay healthy. Take care.
Peace out.